we have patients showing up who have to choose between food, heating oil, and medicine.
We become a country, in essence, that will not let you die, but it's okay if you suffer. We'll take care of you in the emergency room, and there's no follow-up care after that.
Working families shouldn't have to choose between food on the table and health care, and that's exactly what's happening.
The healthcare system doesn't work well for anyone, even if you have very good coverage.
You know, when you have healthcare rising at a rate of sort of 2 to 3 times the rate of inflation, it's not sustainable.
We spend something on the order of 1% of our health dollar, 1 cent of our health dollar on prevention.
Over 60%, 2/3 of all human cancer can be prevented during a normal human lifespan.
Those patients are going to be our patients one day or the next. So let's get them the colonoscopy versus the chemotherapy.
We need to think quite broadly about prevention and still recognize, even if we prevented everything today, starting today, we've still got 50% of the population in this country that have some kind of chronic disease that must be better managed.
135 million Americans have one or more chronic illnesses. We've got a disease system, and we've got to go to a wellness system.
I don't think you can practice 21st century medicine without health IT, and you can't compete globally.
It is the right thing to do. It will make us an infinitely better, more effective healthcare system.
I see health IT as, frankly, our nation's new NASA. If we could put a man on the moon, we can get this right.
We have to have it. It's essential that everybody talk to each other, otherwise patients die.
The healthcare problem is the economic problem. We can't solve our economic problem unless we get healthcare reformed.
There's more agreement than disagreement around this table. And I think the same thing's happening in America, and I think the same thing's happening in Congress.
We can get agreement, I think, from all big business, middle-sized businesses, Democrats, Republicans. We need to tackle what we know we can get done.
I've not yet met a patient who signed into any hospital I've been in the last 5 years who was required to sign in as a Democrat or Republican or conservative or liberal, a businessman or a union man. We sign in as sick people, and we're looking for one thing. We're looking to get well again.